Hi, I'm Kristen Burt for Lifescript.com. Women are often too embarrassed to ask their doctor questions about their bodies, especially when it comes to their period. But it's important to know what's normal and when you should seek a doctor's advice. Lifescript sat down with Dr. Jessica Shepard to talk about heavy bleeding and what women need to know.
So for heavy periods, when it comes to women, at what point is it not normal and it's time to see your doctor?
That is probably one of the number one questions that I get in the office is my period considered heavy? And that really is dependent on the woman, what she thinks. So heavy periods can range anywhere from changing your pad every hour to maybe being anemic because of the blood loss. So if you have any dizziness, shortness of breath, if your heart beats very fast, you should be observed by your doctor, get some labs drawn to see if you're anemic. And also, your quality of life. How does it affect your quality of life? So if you find that you can't go places, you can't hang out with your friends, if you can't go to work, those are reasons that heavy bleeding is interfering with your life, and you should talk to your doctor about that.
And what are the usual causes for a heavy period?
Number one reason for heavy bleeding is fibroids. That is the number one cause that we do hysterectomies for. But other causes of heavy bleeding can include polyps, which are small little growths inside the cavity of the uterus. And also if you have thyroid disease, depending on obesity factors, those can really increase your risk of having heavy bleeding as well.
So what's a fibroid? Because I'm like, I've never experienced them. So what is one?
Fibroids are actually very common. They're not always diagnosed in women, but a lot of women have them. Up to 50% of women by the time they're 50 will have a fibroid. And for African American women, that is increased to about 70 to 75%. But they are the most common benign tumor of the pelvis. So they're not malignant, they're not cancerous, but they are a tumor. So a tumor is just a increasingly overgrowth of any type of cell. And it's a smooth muscle cell tumor that's in the uterus and can grow to very large sizes or very small sizes.
So what are the solutions for getting rid of your fibroids?
So many solutions, and that's, the beauty of medicine and technology is that it allows us so many options as physicians to give to women. So that can go anywhere from oral contraceptives, any other birth control methods such as the IUD, which is inserted in the office. You can also have the implantable in the arm, which is a form of contraception as well. You can also do procedure types such as endometrial ablations, where you treat the lining of the uterus, and that is for women who are not childbearing anymore or finished with childbearing. You can also do a myomectomy, which is removal of just the fibroid and keeping the uterus intact. And that is a great way to take care of fibroids if you still desire childbearing. And then the last, which is what we call the gold standard, and the reason we call it the gold standard is because then you won't have any more bleeding at all, is a hysterectomy. So that's usually like the last stage. But some women, if they desire a hysterectomy, maybe in their 40s or 50s, that really is up to them. But the conversation is the most important part, making sure that you talk to your gynecologist about what options are good for you.
Could they come back? Let's say you didn't go the hysterectomy option, but could they come back?
Yeah, so actually, they can come back, but the recurrence risk is low. So this is based on, for women, this is research done on women who've had a myomectomy, meaning actually taking the fibroid out of the uterus, and that's what we have, a major surgical procedure. The risk really is maybe 25 to 31% of recurrence, but that's a low number, but for the women who are in that 25 to 31%, that is not such a low risk for them. So yes, they can come back.
And what is causing these fibroids?
So that is the question I would love to answer. It's the million-dollar question, but fibroid research really hasn't been given a lot of funding, so we don't know some of these answers. But what we do know is that your risk for having fibroids is increased genetically. So if your mother, your sister, your grandmother has fibroids, it's going to increase your risk of having fibroids, as well as obesity is a factor as well. And so those are the two things we kind of look at when we think, could this woman have fibroids? We kind of look into genetics and also ultrasound. We'll be able to detect them and see if they have fibroids.
And finally, is anything like diet, exercise, will that reduce your risk of fibroids?
So what we find is that diet and exercise reduces your risk of inflammation internally, which we know that fibroids, or in general, tumors, are an inflammatory process. So that can help maybe put them at bay, but it's not necessarily going to decrease your size or not allow you to have fibroids, because there's such a strong genetic predisposition to having fibroids. But anything that can help, I advocate it, and I think that women in general should advocate for healthy lifestyles through diet and exercise.
Fantastic. Thank you, Dr. Shepard. Appreciate all your tips.
Absolutely.